Hi, I'm Dr. James Toe. I'm a colorectal surgeon at Westmead Private Hospital. Today I'll be talking to you about early detection of bowel cancer, the role of screening and colonoscopy, and who should get a colonoscopy. The red flag signs of bowel cancer include perectal bleeding, iron deficiency anemia, altered bowel habits such as constipation and diarrhea, usually for more than 3 weeks, unexplained weight loss, abdominal pain, and those who have a personal history of polyps, a personal history of cancer, or a family history are at the greatest risk of bowel cancer. However, up to 60% of patients with bowel cancer actually have no symptoms, and this is why screening is so important. Bowel cancer usually occurs in individuals more than 50 years of age. However, 12% of bowel cancer occurs in individuals less than 50 years of age, so that bowel cancer can actually strike at any age. The decision for a colonoscopy depends on several factors. So patients who come in with perectal bleeding that is persistent in the young age group, or patients who come in with perectal bleeding who are over the age of 50 are usually recommended to have a colonoscopy. Other indications for a colonoscopy include patients who have a family history who are above the age of 50 or 10 years below the index case, i.e. The family member who has got a cancer, patients who've got a personal history of polyps or a personal history of cancer, and patients who have any red flag signs. So patients who require colonoscopy require bowel preparation. So this involves taking a sachet of bowel prep, which can be Pico Prep or Glyco Prep or Pico Prep C, which you can buy from your pharmacy. You take this 3 times a day with lots of water. On the day prior to your colonoscopy, you'll be asked to stay on clear fluids, and on the day of your colonoscopy, you can't eat or drink anything. If your surgeon sees a polyp, he'll remove all the polyps for you. If he sees any cancers or anything more sinister, he'll usually perform a biopsy and take photos for you and explain to you the next step. If a cancer is detected, the usual process would be to get you to come back to see the specialist in the rooms, and he would explain to you what the next procedure is in terms of surgery, chemotherapy, and radiotherapy. I urge you to be vigilant for signs and red flags of colorectal cancer. This is because if colorectal cancer is detected early, the cure rate is 90% at 5 years. However, if colorectal cancer is detected late, the actual survival rate drops to less than 15%. This is why it's so important to have adequate screening and have early colonoscopy if there are any concerns that you might have a bowel cancer. The National Bowel Cancer Screening Program is a program from the Australian government administered to patients between the age of 50 to 74. From the age of 50, 55, 60, and then every 2 years afterwards to the age of 74, Australians are actually given a bowel cancer screening kit in which they can detect if there's any blood in their stool. If patients have a positive fecal occult blood test, i.e. their bowel screening program is positive, then they should be referred to a surgeon or a gastroenterologist for colonoscopy. This is because 4% of patients who have a positive fecal occult blood test will actually have a cancer. This is why it's so important to actually undertake the National Bowel Screening Program that is sent to your mail. I look forward to looking after you at Westmead Private Hospital if the need arises.